progressive weakness in both lower extremities. More recently, patient diagnosed with pneumonia to both lower lobes. You are seeing patient at home. Overall strength is fair. 1, chest PT to involve lobes. 2, overall conditioning exercises. And 3, increased strength of both lower extremities. So first we'll do the chest PT.
Okay, tell us why and how and where and
Why and how? So we want to help.
why, where, how.
Help get the secretions out of the chest or
Okay.
out of the lower lobes.
Okay.
So I'm going to do it on the lower lobes and side lying. Since it's an older patient, you don't want to lay them prone. So I'm going to do it for 2 minutes.
Okay. What's that called? What position is that called? Side lying.
On which side?
Is it? I can't remember.
Segmental? No. Linguinal?
Are you doing
Linguinal?
a
No, that's a
traditional
low.
postural drainage position?
Modified.
You're doing a modified postural drainage position, right? And you're gonna do posterior, lateral, and anterior, right, all together?
Okay. Hi Diana, so we're gonna do some chest PT to help you get the fluid out of your lungs. So can you lay on your right side? Bring your feet up. Put your left hand over your head.
Shoes.
Shoes. Come over here. With some percussion.
Okay, let me hear.
I'm hitting her pretty hard. Yeah. I'm gonna break
Because she
the.
has a sweatshirt on, that's why.
It's an 82-year-old break a rib. And I'll have you sit up and cough. Huh? Vibration.
Okay, what's your instructions for vibration?
Breathe out.
Breathe in through your nose
Breathe out again.
and puff your lips and blow. And then vibrate, right? Good.
Sit up.
Okay, make sure you do all three, right? Do lateral, do anterior, do
Mhm.
posterior. Let me say, come on, this is gonna be on the finals, so you might as well practice now.
I'm sweating.
And on the written, right? Maybe.
Yeah, maybe.
We do the breathing. In through your nose. And out through your mouth. Good. Lift it up for it. Your legs down. Sit up and cough.
Where's your tissue? Alex, get her a tissue, please. Napkin, paper towel, anything. Gotta be prepared, right? What's your instruction for coughing?
Deep cough.
Learn deep breath in, 2 strong coughs out. Right, deep breath in, 2 coughs out. And if they have an incision anywhere, what are you gonna do?
Incision?
They don't, but if they do, they have an incision in their thoracic area, what are you gonna do?
Hold it together.
Split, yeah, exactly. Split and cough, yeah. So if you have a sternotomy, say you have a sternotomy and you're a status post-CABG patient, what you wanna do is take that pillow,
Squeeze it.
put it over your incisional area. Instead of doing this, because the textbook way to cough is extend, breathe in, and so you don't want to extend, but you want to hold it, take a deep breath in, and 2 hard coughs, yeah. Okay? Anywhere you have an incision, you want to splint it. It's just like what Michael said, you kind of keep it together, right? Because when you cough, what happens to your incision? Right? So you want to hold it next to your incision. You wanna lean into that incision, and then deep breath in, and two hard coughs. Okay? Do you remember that or
I didn't,
No, I didn't.
learn it.
no? I'm sorry?
I don't remember learning it.
The incision, no.
No splinting and coughing, okay. Well, we'll talk about it again next time, or next week, I guess, when we talk about cardiacs.
Okay, so now do the next one. We're overall.
Okay, and you would do both sides, correct?
Right. Both lower lobes.
Okay, what are the
Okay.
traditional postural drainage positions for this patient?
Prone,
Prone,
prone, flat, or
prone,
decline.
head down, for
The
what lobe?
base of-
Posterior lower lobe, okay. If you were doing all traditional postural drainage positions, what would you do? Prone head down for posterior postural, or
the basal.
prone head down for posterior, then
Sideline,
sideline head down
head down, arm up.
for
For the lateral. figure.
lateral lower lobe, and then
Supine,
supine
head down,
head down for
the anterior. lower lobe.
anterior lower lobe. Good? Okay, but for this patient, you decided to do what?
Sideline,
To,
prevent, or their older patient laying on their stomach.
Okay.
being- With their head down. Be a little harder to breathe and uncomfortable.
so you modified it also for energy conservation, right?
Yeah.
To conserve this patient's energy because they're older and you have a lot of things you wanna do, right? So if you spend 6 positions just doing chest PT, do you think they're gonna get up and walk and do exercises and all that stuff?
No,
No, they're gonna be shot, right? So you wanna modify the position to conserve energy. Okay? Alright, good.
Alright, so to promote overall conditioning, we decided to
Nice
do
job, Darren.
active range of motion
Okay,
for the whole body
okay,
to prevent contractures, just improve blood flow on the area,
excellent.
and just strengthen the muscle.
Mm-hmm.
So we did it on sitting down against gravity so that she has resistance.
Okay.
Alright, so
What kind of strength does she have?
Okay.
Fair? Okay, so is active range of motion gonna strengthen her?
She has limit range of motion against gravity.
Okay.
Yeah, we all have
Yeah.
two bodies.
It's gonna improve range of motion, but it's not gonna strengthen
Why?
the muscles. It's not being decent, it's not, muscle not contracting.
Okay. Well, it is contracting, right? But you're not doing what? You're not using what principle of strengthening?
Overload principle.
Overload principle, right? So totally, everything you said was perfect except strengthening. Because if you're doing active range of motion for someone that's fair, you have to overload the muscle, right? And to overload it, you need to do manual resistance or at least 1 to 2 pounds. So up to you, if you wanna strengthen.
Active range of motion. Alright, so hi Dan, I'm Darren, PTA. So today I just want you to move your arm just upwards in your front. Alright, and then slowly lower it down.
So this is just overall conditioning, he's just doing conditioning.
So do that for about 10 times. And then now I want you to do it on the other arm as well. Alright, and after that you can do it on the side as well. Good form. And the back too. So for the legs, can you just straighten your knee out, and then slowly lower it down,
All the way up,
all the way up.
get full range.
Alright, then do the other way.
This one hurts.
Hurts?
Alright.
Yeah.
Oh yeah, from your sports
Yes.
accident. I'm sorry, I forgot to ask you how you're doing.
Then you can also just raise your whole leg up to target the hips. can extend your toes to your nose. All right. For like dorsiflexion.
Nice.
And then try to push the floor down.
Which is
Yeah, for like the gas trucks. And then try to rotate your leg inward and outwards.
Does it hurt?
no.
Only strengthen,
Yeah.
only straightening and bending. You're not swollen though. That's good.
No, it was like 3 days. No, no more.
Okay, good.
Alright, so what I'll be doing, I'll be increasing the strength of the both lower extremities.
Okay.
So hello, I'm your student PTA. So what we're first gonna do, let's get some weights on you. So some 1 pound weights. Let's get your shoes on. Alright.
Put 'em on.
And for conditioning program, talk to me about, duration and reps and all that stuff.
So we could do it like 3 sets of 8 because we don't want the patient to be tired because she's 82 years old
Yep.
and she has like post polio syndrome.
Okay.
It's 8 reps probably good.
Okay. Yeah, just something measurable, right? What else could you do besides reps to make it measurable?
Time.
I'm sorry?
Time.
Time. So you could do, 30 seconds, you could start with 20 seconds, 30 seconds. Yeah, I started doing this, I think I told you the other day, I'm doing this program with my mom using Alexa. Have her, saying, Alexa, set the timer for 3 minutes, and she walks the hallway up and down, up and down. Or, I have her doing, marching in place for 30 seconds. I mean, those kind of things are really helpful, I think, for home exercise programs, if they have something like that that reminds them. And time, sometimes it's easier to set a timer than to say 10, because then they lose track or they get distracted, especially with the elderly. So if you say like 3 minutes or 2 minutes or 1 minute or whatever, sometimes it's easier for them to grasp, if they have somebody to time it for them.
Or until a certain point in the song.
I'm sorry?
I think they mentioned in the video, like if you're doing an activity until a certain point in the song.
Yeah.
So like until the chorus comes on, you're doing a certain exercise.
Yeah, or when I have my mom also doing, I gave her TheraBand, and I said, every time a commercial comes on, do, stretching or use the TheraBand during a commercial. So you can, use all kinds of things for them at home to make it, more functional and so that they'll remember.
Alright. So now, we got the weights on. I'll put this right in front of you. So I want you to be able to push off the bed and reach for the walker, okay? So on the count of 3. 1, I'm gonna contact guard because for balance, I think.
Okay.
So 1, 2, 3, push, reach.
And why, you're on the right side for any specific reason, or?
Oh, I should have asked whether, which side are you more comfortable on? Okay, right side, perfect.
Are you right-handed or left-handed?
I'm right-handed.
Okay.
So I already knew I know my patient.
So why are you on the right side?
So,
That's dominant.
Okay.
Go home.
Alright, so see on this side.
Yeah, he needs some coffee before his exam.
So what I'm gonna do now, I'm gonna contact guard you, I'm gonna take steps. So the purpose of the weights here is for as she's taking a step, it's gonna like strengthen while she's going down, up,
Right.
things like that. So let's take a step. Alright, so another one, feels okay so far. Alright. So now let's turn, left side.
What I thought you were
What?
doing
No.
marching.
No, I was gonna just to come back over here, so I'm not gonna make her walk backwards.
Okay.
Backwards is okay.
Alright?
You're just doing marching in place, I think.
Oh, I thought we discussed walking. Alright. Turns.
change it up right
We'll do it live, alright? Obviously marching,
He was warming her up first.
alright? And then
Warm
let's take a
up.
sit down.
Why don't you play for 2 minutes?
For 2 minutes? 2 minutes is a long time.
But you have to walk in.
Yeah, yeah, yeah.
Also you have
No,
concentration.
just, it's funny, you know, when you start to like set timers for 2 minutes, it's a long
Yeah.
time. Patients get really tired with the 2 minutes.
So now let's reach for the bed. Slowly. There we go. Take off the weights. She's independent.
Tries to do as much as she can.
Exactly.
Okay, pick your patient.
Josh?
There are shoes, Josh.
I literally, I do have a lot of back pain.
It's seated, seated. Seated. I need some coffee.
We all do, yeah.
And went side to side. While sitting, put both hands down to side and push yourself back and forth, shifting your weight. Slowly, breathe, 5 sets of 10 reps.
While we're watching TV.
2,
Just
3,
for
4,
cutting
5.
weight.
Nice.
Dips. Put hands aside and push yourself off chair and hold for 10 seconds 5 times. Make sure to breathe and go slowly. So I need to go into a chair. Well,
But you just do it.
I just do it here. Yeah.
Yeah,
2, 3,
it's the same.
So you don't want him to come, can you read the instructions again?
Put hands to side and push yourself off chair and hold for 10 seconds 5 times. Make sure to breathe and go slowly.
Okay, and maybe you would put, for somebody like that, don't stand up, right?
Right.
Yeah, that's it.
Just stuff we can do while we're
Yeah,
watching
on the
TV.
couch, yeah. It's good. Okay, read your note, please.
82-year-old patient with history of post-polio fair strength, both lower extremities weakness, and lower lobe pneumonia. Patient complains of shortness of breath, increased secretions, also states, can't move my hand.
Of
States
progressive.
progressive weakness and fatigue, especially both lower extremities. PTA performed chest PT on both lower lobes for 2 minutes. Patient performed active range of motion and sitting for both lower extremities and upper extremities to increase overall condition with verbal cueing. Patient performed marching in place and standing with 2-pound ankle weight while supporting herself with rolling walker. 2 minutes with contact guard. But I guess she walked around in a circle. Patient able to cough after chest PT, or for assessment. Patient able to cough after chest PT. Patient showed motivation performing active range of motion, was able to march 2 minutes without fatigue. Plan continue with plan of care, progress activities to increase difficulty, and follow home exercise program.
Okay, so give me a sentence for the cough, and where would you put cough?
Yeah.
Where would you put your cough?
Assessment?
Objective.
Usually.
Objective.
Yeah, I would put it in the objective. Give me a cough sentence in objective.
Patient performed adequate call.
That's assessment, right?
Mhm.
That's assessment. Strong, strong, or patient's cough is improving, or something like that. That's assessment.
Productive cough?
Yeah, so give me an objective cough sentence.
Patient.
Cough is,
Yellow liquid.
How much fluid?
Yellow stew or something?
yeah, all that stuff. Cough is,
2 years.
One handful of brown spear.
cough is weak or strong,
Strong,
okay? Dry or moist,
moist,
productive or non-productive,
productive.
times
2.
of,
2 of.
How many times the cough total?
Yep, productive times 2 of what kind of sputum?
Clear or yellow?
Greenish yellow.
Greenish
Oh.
yellow.
Transparent.
Okay, let's say the whole sentence, okay? Cough is
Cough is productive.
Strong.
Strong.
moist.
I can't think. I had too much confidence here. That's someone help me.
That's okay, it's for the whole class. Cough is strong,
Strong,
moist,
moist,
productive times
times
2 of thick,
thick.
yellowish or greenish, whatever, sputum. Okay?
Cough is
Do you get it? That's detail.
Yeah.
But that's what you should be doing. After a chest PT, you should be documenting cough. You should be documenting sputum. Because that really is telling of what's going on, right? I mean, clear as opposed to moist and productive, you know, weak as opposed to strong, right? So it gives you an idea, so when you go back the next time, hopefully that sputum, as they get more and more antibiotics in them, won't be as greenish or yellow. Maybe it'll be clear, maybe it'll be white. Maybe it won't be productive. You know, sometimes production is not bad. It means that they're getting the, you know, the sputum out. But, you know, if it's non-productive, it's non-productive. But if it's weak and non-productive, what's that tell you? It's not effective. Exactly. So your assessment is, you know, not effective cough, right? And your plan is to work on an effective cough or to strengthen the cough, right? Because that's the only way they're going to get, you know, rid of the pneumonia, besides medications, is you draining them and getting that stuff out. Okay? Make sense?
Yeah.
Okay. I know it's not always pleasant to describe sputum, but it's important. It really is important, especially when you're working with a lot of pulmonary patients. Because it's a way to keep track is, are they getting better? Are they getting stronger? Is your cough effective? Okay? All right. Data, even in sputum. Okay,
So you have
thank
to
you.
cough into the napkin and then check it out.
Yep. Then you say, open it, and then I usually take another napkin and take their napkin and throw it out. Or sometimes if you're on the floor, if you're on inpatient, a lot of times the nurse will say, can you get me a sputum sample? Because they know that you're gonna do a chest PT, so they'll give you a little cup, and they spit into the cup, and then they'll send it to the lab. So. Yeah, it takes some getting used to, but I love it. I love sputum.
Or blood too, right? If there's blood, that's
Yeah, you
not
say
good.
blood tinged or bright, BRB, bright red blood is not good. Then you go talk to the nurse, right? If you have bright red blood sputum,
No bueno.
write to the nurse. Or call the doctor if you're in the home. You don't want to see bright red blood anywhere. You never want to see bright red blood, right?
Well, actually, it's worse than coffee ground.
Coffee gran is even worse, that is true. That is true.
Well, it's
Yeah, that means like a massive GI.
Because bright red means it's close. Yeah, you could scratch
I
it.
know how to do it. Oh, great.
No, yeah, no,
You
we need a
guys-
better chair.
You guys suction, right? You can suction?
We need to learn it.
As a firefighter?
Oh,
Or
sorry.
is
Yeah,
it-
that one's, yes, yes.
This one's better.
You do nasal or
Yeah,
oral
because that one's,
suction?
you know, gonna move.
I mean,
What?
when I worked in the ER, they had me doing NG tubes, but.
Yeah, this is ours.
It's tough.
Right,
Okay. Case, please.
patient is 48 years old, diagnosed with MS 2 years ago. Patient with exacerbation of symptoms, now in the hospital. Ataxic movement noted, fair plus strength throughout. Patient ambulated independently prior to admission.
Okay.
So,
So prior to admission, they were fine, right? They were sort of doing their thing. And now they have an exacerbation and they're really having a lot of symptoms and difficulties. And it's exactly what you see. All of a sudden, one day, they're just a mess. And they have to go back to get the rolling walker out of the closet, right?
Alright, so first we're gonna start with overall strength. So yeah, the strength sphere plus, I'm gonna do manual resistance for hip flexion.
Great.
So I'll just do that on either side. So what I'm gonna ask you to do is to bring this knee up towards the ceiling, okay? But then I'm gonna go here, resist here. So bring up and I'm gonna press you down on the count of 3. 1, 2, 3, go.
Go, go, go,
Go, push, 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 push.
Good.
And I do same side, but then I would only do a slight resistance because of the strength grade.
Good.
That plus.
Where should her hands be?
Yeah, it's because she has ataxia especially, so you want her really to stabilize,
To hold on.
to hold on.
But what was she doing? She was pushing on her hands, right?
Right,
Where should
yeah.
her hands be? Or on her lap or whatever, you know? Because you want to try to avoid substitution.
Right.
And I sort of like. But, you know, you may have to put your hands down and hold yourself, right? So,
Right.
you know, you get better at like noticing, like, stop cheating, stop. Only hold yourself, don't push down.
Is there
It's
resistance?
constant refinement, refinement, refinement. So you're just doing hip flexion?
No, there's one other one. So she'll come over here to, you know, to a surface like this.
She's got ataxia, she's got ataxia.
Yeah, if you snap your fingers, sometimes they move faster.
The ataxia stops.
The ataxia just magically stops. Oh, what other exercise?
Coordination.
Oh, that's right, yeah, I forgot the coordination. Let's do that. Okay. So the other one would be coordination to you promote fluid coordinated movement. So that'd be like touch your nose, then touch my finger here, go here, here, back to nose, and we'll just repeat that.
Okay, what would you progress to? That looked pretty fast to me. So what would you progress to? Exactly.
Oh, slow.
Very
Yeah, to regress slow, yeah.
Yeah. So
And
just
then-
say, okay, now as slow as you can.
Yeah, now as slow as you can. Touch my finger. Over this side.
Is that slow enough for you, Joe?
It's too fast.
Yeah, it's a little bit.
Okay,
I
so
like
just
here.
cue her, just cue her.
So
Constantly
slower.
talk to your patient, a
Slower.
little bit slower, a little bit
slower.
faster.
Or if you have you can use the metronome here, right?
You could. For this
Yeah.
one, that's a
little bit
perfect
slower this
metronome.
way. Now slower towards your nose. Touch it, slower.
Easy, good. Good.
So you can do that. What those? And now, and then, oh yeah, the lower extremity one. So if you could do fast, the heel slide. So place here and then go up to your kneecap. That fast would be, you know, one way, and then if you go slow to progress it. So 1, do a count of 5 in your head. 1, 2.
2, 3, 4, 5.
Mhm.
Nice.
So you can do that. Is there anything else on this? No. Just check.
And now upper extremity strength, right?
Oh, upper shoulder. Oh, wait, I thought we did that for the home exercise.
Oh, yeah.
Yeah,
Okay.
yeah. So place these on you.
Yeah, sometimes what they're using now are weights, weights for the lower extremities, and weighted vests help with ataxia. Or tremors or anything like that. They've been traditionally using them with kids, but now they're starting to use them with adults with a lot of, good results. They just put like a vest with weights, cuff weights in it, and it helps to ground the patient, it helps to diminish the ataxia. Not forever, but for that time that you're working with them.
And then just wrap. Move all obstacles out of the way.
Looks like that one weight's falling off.
Yeah, these are weird.
They're weird,
Yeah.
probably inexpensive.
So yeah, the other exercise we would do is a rollator over here. It says on the note, 3-point gait, just to do reciprocal movement. And it'll be 25 feet, so like realistically, it'll be like to the end and then back.
Okay, and what are you trying to promote?
It'll be to decrease ataxia.
Okay.
Alright, so I'm gonna ask you to do so. Which side is your dominant side?
Right.
Right side. Alright, so I'm just gonna go over here just in case. So what I want you to do is place your hands on here and then pull yourself up. 1, 2, 3. Right, so we're gonna go over.
It's always better to put your hands on the bed, right? Especially with something that wheels. If you pull it, it's gonna go out from under you.
So also I can walk closer to
And
here.
make sure those brakes are locked before you have the patient stand up, right?
Right.
You push them down. You
Yeah,
push
push
the
down.
handles down to stand up, and then you release it.
Right, so I'd like you to do is take a step with the left foot, and then move your right arm. And then take a step with the right foot, move the left arm, and you're just gonna repeat that sequence. Sing 1, 2, 3, 4. 1, 2, 3. No, that's a little bit too fast. So and then come back this way.
I'm tired.
It's tired already. So repeat the same sequence. Left foot, right arm, right foot, left arm, left foot, right arm, right foot, left arm. Same thing. All right. Bring you to the walker. And so then you come a little bit closer to the walker. It's locked. Then I'll unlock it. Right, and then come back here. Sit down. So there was that, and then
What about swimming?
it's all on me.
No, come on.
The other one, the other exercise,
Let her do something, Jim.
you do the hip abduction
That's
one.
the same thing.
Yeah, I sort
I
of.
should have stayed.
We should have just stayed over there.
Welcome.
Pretend.
Pretend, yeah. But yeah, it's just another exercise, you know,
Okay.
strengthen hip abductors, you know, which is especially important for gait, you know, stabilizing pelvis.
Okay, Vanessa, I would like you to raise your right leg up. Slowly. Okay. And I repeat it 5 to 10 times. So strengthening the quad muscle and
And you might alternate just to try to avoid some fatigue, do right foot, left foot. Instead of 10 on the right, then they get more fatigued, but if you switch it up, it's a little bit better sometimes for patients, for neuro patients especially.
so do the same thing, but this time you put your leg up like that. So yeah, that's fine. It's good. So do we do the marking thing?
Yeah, well, just say it. We came up with like a exercise to like do all of them, like strengthening and improve fluid movement and
Mhm.
ataxia.
Okay.
And we were doing like the claps, right?
Little claps, yeah, that too.
Touch.
Oh, okay. So it's okay.
Alright, I'll. Alright, so
The noise too.
the noise, I count to 1,
Okay,
2.
so Marisa, you use your hand to reach my this side and
Joe.
your right leg. Okay, good. Okay. Wait, this side.
Oh, he's pretending to be a metronome.
Yeah.
Okay, I like it. I just, I wonder about her balance.
Right,
If she lost her balance, how would you catch her?
You won't.
You wouldn't.
You
So how
wouldn't.
can we make that safer?
Joe could be behind her.
I'm sorry?
Joe would just be behind her.
Yeah, Joe could be behind her, or
Or
you
just
could
sit.
put a-
Put the rollator behind her or a chair behind her.
Yeah, or, yeah, you could have, a nice little volunteer follow with the chair.
Right, yeah, the chair
Or
behind.
you could have the gate belt,
Or
and you could hold the, put the strap in the front and just hold her just in case.
you were holding from the front or the?
Yeah,
Holding
from the front.
Okay.
Because you don't need your hand, like she's touching your shoulder, right?
Mm-hmm.
So if you hold her in the front, and then you can just pull her if, you feel like she's going backwards, okay? Always make sure you're in a position to catch that patient if they're going somewhere. And, sometimes they can have good balance and still lose their balance. I mean, you think of all of you guys, right? Anybody ever fall in the street? Anybody fall recently? Only me?
You fell recently?
About 6 months ago.
Oh.
Yeah, it was just like, the sidewalk was wet. They
Oh
were,
yeah.
Yeah, especially when it's like ice in the street.
it was a restaurant, and I think probably there's a little oil, and they were washing down, and I just went.
Yeah,
I
it's
didn't
quick.
hurt myself, but, it just,
Like
it
that.
just happens, right? Falls just happen. So you always have to be ready. Okay, so don't put yourself in a situation where, you're concentrating so hard and then all of a sudden they fall backwards and hit their head, right? Always be thinking, what if, what if, what if, what if? Okay? Good, nice job. Okay, pick your patient. Are you done?
Oh,
Okay.
the.
Okay, pick your
yeah.
patient.
Kevin.
On your back. Bend your knees. Arms to your side. Bring your hips off the bed and hold 5 seconds.
That's a great one. Bridging is always fabulous, right?
Mm-hmm.
And they
And
have
then repeat
more
10 times.
strength as well.
Yeah.
Repeat 10 times for 2 sets.
You said the hold, right?
Yeah.
You held it?
Yeah, for 5 seconds.
Okay, good.
And then the second one, arm raises with can.
Like if you could do it at home, if you had like a can of soup or a can of beans,
Beer.
you can get it with food. Oh yeah, just food. It's too heavy.
Yeah, most soup cans are about a pound, right?
Yeah.
Keep elbows straight and thumbs up, arms aside.
Nice. Very descriptive.
Go up and down slowly. 3 sets of 10. Don't forget to breathe.
Good, nice. Okay, good job. Okay, read your note, please.
48-year-old patient diagnosed with MS 2 years ago. Patient with exacerbation of symptoms with heat exposure. Fair plus strength throughout. Patient ambulated independently, PTA prior to admission. Reciprocal upper extremity, lower extremity movement, 3-point gait with rollator and parallel bars there and back 25 feet. Decreased tone, we didn't do this, but that was just another one. Decreased tone with peanut ball rocking, 30 seconds times 2. Manual resistance of hip flexion, 8 reps times 3. Assessment, patient displayed fatigue with their Therex. Provide verbal cueing to optimize proper muscle improvement. Overall, patient is improving gait pattern and lower extremity strength. And for P, continue with plan of care and follow up. Evaluate patient goals for the next visit.